Hello and welcome to another educative episode of Joa's Medical Diagnostics. Today we'll be treating fallopian tube blockages, causes and treatments. Have you watched our previous topic on peptic ulcer and ovulation? If you haven't, kindly check our Facebook page. Fallopian tubes are essentially for conception. 1/3 of the cases of infertility would lead you to blocked fallopian tubes. What are the causes of fallopian tube blockages? How do we test them and what are the treatments? Let's find out more about tuber blockages. What are the functions of fallopian tubes? Every month, the ovary releases an egg which is picked up by the fallopian tube. In the tube, it gets surrounded by sperm and only one will gain entry into the egg and fertilize it. The embryo created stays in the tube for 4 days and keeps developing. The tube provides the environment needed for the embryo to develop and also moves the embryo towards the right direction by sensory and muscular action. By day 5, it travels down to the uterus. Here, it gets implanted and pregnancy occurs. So, a normal and functional fallopian tube is vital for natural conception. If the tube is blocked, the sperm and egg will not be able to meet each other and pregnancy is almost impossible. What are the causes of tubal damages? The most common causes of damage in the fallopian tubes are infection, sexual transmitted infection like chlamydia or gonorrhea, tuberculosis, infection after abdominal surgery, infection after miscarriages, or termination of pregnancy or intrauterine coil. Even subtle infection which may not have given you any symptoms can still cause damages to the fallopian tubes. Other causes are smoking. Both active and passive smoking can cause tubal blockages. Endometriosis, previous ectopic pregnancy, fibroid depending on its position can also cause blockage to the fallopian tubes. What are the different types of tubal blockages? If the part of the tube close to the uterus is blocked, it is called proximal block. Sometimes blocked in the middle of the tube. If the block is in the part of the uterus, it is called distal block. Sometimes the finger-like protection can enter the tube and get damaged, called the femoral block. If the tube gets swollen due to collected secretion, it is called hydrosalpinx. What are the symptoms of blocked tubes? Tubal damage do not give you any symptoms at all. It is usually diagnosed at the time of investigation for infertility. You may have symptoms due to the factors causing tubal damage like pelvic inflammatory disease or endometriosis. Occasionally, if you've got hydrosalpinx or swollen tubes, the fluid from the hydrosalpinx can trickle back into the uterus and give you vaginal discharge. How do we diagnose tubal blockages? The first step to diagnose tubal blockages is to take a detailed history from you. Nobody is born with blocked tubes. Tubes get blocked if you have an infection, endometriosis, previous surgery or ectopic pregnancy. So it is important to find out if you've got any of these risk factors. If you don't have any of these risk factors, then the chances of you having tubal blockages is extremely low. In that case, you can carry in naturally. If you have no problems with ovulation and your partner's semen parameters are normal, majority will fall pregnant naturally. If you do not conceive in 6 to 12 months, then you can consider testing your tubes using tests like hysterosalpingogram, HSG, or hycosi. In that same stream, dye resistance into the uterus are taken. If the tubes are open, the dye can be seen flowing out from your tubes, but the dye will not flow if the tubes is blocked. If HSG shows that your tubes are open, then it is quite accurate, but it's not very accurate if the tubes are blocked. 6 out of 10 women diagnosed with blocked tubes on HSG will find their tubes to be normal if they retest with HSG or undertake a laparoscopy. So, if you have been diagnosed with tubal blockage with HSG, then please remember to retest to confirm. In hycosi, hysterosalpingo contrast sonography, instead of X-ray, Ultrasound scan is used to see if the dye is flowing out through your tubes because additional benefits during the ultrasound scan. Your uterus and ovaries can also be checked, and if it is combined with 3D scan, it further increases the accuracy of the results. If you have gotten any symptoms of endometriosis, like pain in the lower abdomen or painful period, then laparoscopy is advisable to test your tubes. At the time of laparoscopy, it can be checked if you've got any endometriosis, and it can be treated at the same time. Another frequent question asked is it possible to get pregnant with one tube open? If you've got one tube blocked and the other tube is normal, then you have every chance of falling pregnant naturally or with IUI. If you have no other cause of infertility, it is a good evidence that women with one fallopian tube have the same chances as women with both tubes normal. What are my options if both tubes are blocked? If both tubes are blocked, then the options of surgery or IVF. Surgery cannot be done in all cases. It is only possible if the blocked or minimal and majority of the tubes look healthy. However, after the surgery, there is an increased risk of ectopic pregnancy. Surgical or anesthetic complications and the tubes can get blocked again. IVF is preferred if you have other causes of infertility like abnormal semen parameters, or you have been trying for long durations, or if the tubes are badly damaged beyond repair. In that case, do not waste time trying to fix the tubes, rather move on with IVF sooner. Delaying IVF will only reduce your chances of success. Can you open a blocked tube without surgery? Only in certain cases, whether the block is in the proximal part of the tube that is close to the uterus. It can be treated without surgery, and the treatments are tubal flushing and tubal cannulations. Tubal flushing basically means doing a dye test with HSG. The dye flows through the tube and clears up if there is a minor blockage due to the mucus block. There is a good evidence that women do fall pregnant naturally within 3 to 6 months after dye test with HSG. Tubal cannulations is a procedure which can be done at the same time with HSG under extra guidance. A fine wire is passed through the vagina into the uterus and to the proximal end of the tube to clear the block. It is impossible if the block is mild. Moving down to treatment of hydrosalpinx. Unfortunately, if you have hydrosalpinx, the tube is grossly damaged and it is beyond repair. Trying to fix the hydrosalpinx by surgery will not increase your chances of getting pregnant. You should move on with IVF sooner. There is a good evidence that hydrosalpinx can reduce the success of IVF by over 50%, and that is because the fluid from the hydrosalpinx can trickle back to the uterus and can be toxic to the developing embryo. Hence, if you are diagnosed with hydrosalpinx, you will be advised to remove it, or at least clip it or disconnect it from the uterus by laparoscopy before undertaking IVF treatments. In summary, an open functional fallopian tube is vital for natural conception. Also, most common causes of blocked fallopian tube is infection. Both active and passive smoking can cause tubal blockage, so avoid smoking. Even with one fallopian tube, you have good chances of natural conception. See a specialist if you do not fall pregnant in 6 to 12 months. IVF has become the main treatment method for women with tubal blockages, and also surgery can be done with only few selected cases. Thank you for listening. I hope this information was useful. So for any question about the tubal blockage, please put it down in the comment section or reach out to us on our WhatsApp number. See you next time. Thank you.